Hi, my name is Anvitaa Marfatia. I am an associate therapist at Speech Dysphagia Language Clinic that is based in Mumbai, India. So, to address today's topic, the question is how to make a decision about what AAC system is preferred for the child versus for adults. To be honest, when we talk about AAC and its utilization, it's quite a vast subject. Like, it's a very vast topic. There are so many factors that need to be taken care of. So I would go through a couple of factors which should get you very critical in thinking about how we can pick a particular system or how to go about it. That's also really, really important because as a speech language pathologist, that's where is one of your main decisions you have to make because that's what the client is going to rely on. That's what the caretakers, the other professionals working along with this client is totally dependent on this. So a couple of systems do exist, and if I have to classify it broadly, we have like two types, like two of them. One is you have your unaided system, which utilizes your body, where we use gestures and signs and I facial expression, your body language, all of that goes into your unaided system. Talking about the aided system, that's where we utilize some pictures, technology, a combination of both of them, a speech generating device, something as good as the artificial larynx also could be, used in the form of an AAC. So the list is pretty exhaustive. So it goes from like technically no tech to low tech to high tech, depending upon the complexity that we're going to look out for. Now, when I talk about AAC being there, there are a couple of questions that I always ask myself before implementing a system, or so that I have better clarity. And more than the client and the caretakers, it's more of my responsibility to make sure that I'm addressing this correctly. When I look at in beginning with AAC, is it because I want to establish a better form of communication? Is it because I want to re-establish communication? Maybe perhaps the person due to a CVA has just trouble in now communicating, and we want to try to augment his speech, and there is probably a good chance, or in some cases there may not be a good chance. So that's when we look upon at this. Or I have someone with a degenerative disease where I have to eventually make it easy for the client to communicate his simple needs, even something as simple as he wants to go to the bathroom or what. So that is something that needs to be taken care of, and that's very important. The content of what you utilize in your communication system really depends on the patient. Like, it definitely does. You cannot be doing something, like, say if you have a person, an individual who was, say, a banker, or who worked in the stock markets. We cannot be having that kind of content for somebody who's a child, who's probably enjoying nursery rhymes by listening, and like, you can't do that. Like, that's just not the relevant content. So it's very important that you know about the person's background. You also know about his overall development. If it's a kid, if it's an adult, you need to take other skills into consideration, but a couple of them which are common would be motor skills. It would be you have your hearing, you have your vision, you have your awareness and alertness status that you need to see when it definitely comes to an adult. You need to also look into factors of literacy, language, say speech intelligibility, or you have the partner, the main communicating partner, the environments the person is going to use this in. So primarily when I talk about motor is because if I have a child, or I have an adult, or an adolescent who has, say, paralysis of the upper limbs, okay, and or basically just paralyzed, like both upper limbs, lower limbs. He has very minimal movement of it. Uh, if I'm going to use a system where the person has to point to the pictures and communicate, or has to type the words and communicate, or has to, touch the picture on the iPad and communicate, like, it is highly possible that this person is going to have difficulty in maneuvering around, and that kind of leads to frustration. So that's not something I would highly recommend using in such a situation. Then we have to look upon like other situations where we try to use, say, eye gaze, or like, you take help and have someone help you out in communicating what you ask. And Definitely, the eye gaze is a device, the eye tracker is a device that is not very affordable for everyone. So, yeah, it does come with some restriction because it's a very high tech device. Similarly, if I'm looking at establishing communication with a child, getting the child to understand that there is a need to communicate when we want something, we ask for it, I could use the PEC system. And when I'm using the PEC system, we are training the child as per the PECS hierarchy. Like there's a way to go about it. So when I'm utilizing that, I am making sure that the child understands the concept of there is a way we ask for things, and there's a way we go about it. Versus, I do not really feel that the adult needs to understand the essence of that. They usually, if the pre-morbid skills are intact, they do have it. So we look about helping them to be more clear in their thoughts. And with the kids, we can look at augmenting speech. Even with adults, you do simple activities like matching, you can do some typing, you can help them even build up sentences. There could be a possibility where a person is very intelligible in terms of single words, but if I want him or her to speak in sentences, um, maybe typing the sentence and it having an speech output makes it easier for the person to understand. So yeah, it's a very very broad topic in terms of assessing and seeing how to go about things. But yes, there are cases where I have personally definitely come across where we have implemented AAC systems and we have seen like an augmentation of speech. Like we just had to discard the we didn't require the AAC system then after a point, because the child started imitating speech, and like he started being spontaneous also with like his or her own words. So there have been a couple of instances. So it truly depends on how you want to fit in everything. And I have taken like a few important points. I hope this helps, and if you have any other questions, please feel free to message me. Thank you.